Hi, and welcome to Artistic School of Nails and Cosmetology. My name is Julia Tester, and welcome. We're demonstrating today a microdermabrasion with peel. It's the anti-aging peel that takes a woman anywhere from 10 to 12 years younger and 6 to 10 visits. And I'd like to demo that for you today. So if you'll pay attention very closely, I'm going to begin with wiping away any type of moisture there was from the steam that we began with. I'm going to then apply the peel at a 50% because this is my client's 5th peel. We've taken her scars away. We have removed moles, skin tags, spider veins, everything you can imagine that didn't belong on the face. We have also lessened the scar we have here from having her thyroid removed. This looks 50% better, and within 2 more visits, I can make it almost obsolete. This system that we use here also corrects acne, so if you have any client that has acne, you can do acne resurfacing and make the client look 60% better with just 2 visits alone. So today we're taking Kami into her next session so we can make her skin look beautiful. I've removed everything. The next thing I'm going to do is I'm going to apply our 50% glycolic. Today I'm actually layering all of the peels because we've taken her from one to the next and she is up to the part of where we need to really do some serious business today. We're going to begin with the 50% 1.0. 1.0 is the highest in pH and actually does more than anything in the lower number. So we're going to begin with the décolleté. We're going to start across the front, weave back and forth. She'll feel tingling, or a few people have even described it as ants dancing on their skin. Ants aren't biting, they're just dancing and digging their little nails in and doing probably what we would call the disco walk. I'm going to go across the décolleté. I'm going to come up across the mastoid muscle, which is very important. This shows a lot of age. Back behind the ear here, across this area here. This, if I found her dead and we didn't know who she was, or they couldn't do any identification, or they would judge her age by the amount of lines that are here. We've eliminated almost half. It's looking very nice. You want to make sure when you're picking up your item that you make sure that you do not go in any other area more than once until you've completed the whole application. Once I've completed the application, I'm going to come back with a 35%. Layering during microdermabrasion and skin youthening is very important to take it to that next level. When you take it to the next level, you're going to get more achievement out of that. You're going to be able to remove dark spots. Cherry angiomas are the one thing you won't be able to take. You'll have to use your vascular machine for that. But anything that's imperfection looking, acne, we can go with amelias. We'll remove all of those, and usually the first to second service. Everything opens up beautiful for us, and we continue to get down to that beautiful new skin. I'm going to remove our eye covers just because I like to get up closer. We're into the series of where we want to do major correction. Please make sure you pull open and get every area you can. I go into the eyelid area here, making sure that it's not too wet so it doesn't run into her eyes. I'm going to then come down the base of the nose. As you can see on my client here, we removed and made pores a lot smaller last week. It will not hurt them, it will only help them. We're actually resurfacing that part of her skin today and helping it heal quicker. When you get vascular done, it can take anywhere from 3 to 4 weeks to heal if done properly. Try not to come down around the nose. Go to the base of the nose and down, but never around the curvature of the nose because it could actually make a person, especially on their first few visits, feel like the nose is almost decapitating. So we're going to let this sit for 5 minutes. If my colleague would be so kind to run that for me, that'd be wonderful. At this moment, I'm going to go ahead, since I'm layering today, I'm going to add a 35%. When adding 50 to 35 does not mean in any shape or form that it's 85%. The percentage isn't very high, even in layering, but it also assists in doing extra work. And then I'm going to come behind with my Microderm machine after resurfacing with the alpha hydroxy here we're using, and we're going to make sure that we cover every area, especially the décolleté and any area that's red that we have worked on before with the vascular machine, because we don't want any type of hyperpigmentation to stay. Whatever's there, this will help eliminate. Coming again across the mastoid muscle, around in any crease she has. You have them lift their chin so you may see it clearly. Sunspots, this helps them greatly. You can actually take an abrasion type of Q-tip that we have and scratch them up first, put the actual peel on them. Within 3 days, they'll fall right off like they never existed. I didn't use a lot, but I'm using just enough to cover those whole areas, and if my client could speak, she would tell you it doesn't itch very badly. If it was to itch or burn, this is a normal thing. It is not abnormal to feel the product actually working as you're applying. I continuously work on my client to detain or to really distract her more than anything about what it's actually doing, and if I move from one side to the other, it'll move her thoughts to the other area in case of any discomfort. If you would ever put this on a client and they said it's severely burning, you would remove immediately. What does actually neutralize is water. I believe in using ice water with any type of peel, especially a TCA. However, this is still something you always want to do to give your client comfort and to take the fever out of the skin immediately. I'm going to open any area that's deep, pull forward, back towards me. Anywhere there's scars or anything that I've been concentrating on the most, I'm going to come back and pretty much dab in that area. And your client will even tell you, oh, it feels so good. Would you rub over this one area one more time for me? That's just because it's an itch feeling. Make sure you're covering both sides, mastoid, back behind the ear and down. It is not abnormal if you do hit anything that has an abrasion for it to bleed. What it's actually doing is melting and resurfacing that skin into nice, beautiful skin. Spreading open, coming down, back and forth very gently. You can see how they're actually turning a hot pink, that they're actually responding correctly. A lot of people come in there, I'm kind of scared, Julia, for me to have you do that around my eyes. You're not going to go near an eye area that is lacquered in your product. You're going to be a smart person and do exactly the way I'm doing it. Going in each individual line that is still trying to appear. Coming to the eyelid, lift up. Bring across and finish. I always finish on my forehead briskly. It seems to get more of the wear and tear, just like our left arm as we're driving our car here in the U.S. So we're going to leave this on now. How many minutes do we have left, my love?
You said 5 total?
Yes.
We're good.
Okay. If you'll go ahead and add 2 more minutes to that, since I did an extra layer today, I think we'll get much more results out of it. She's not complaining. Do you feel any discomfort at all, Amy?
No.
With each visit you came, didn't it seem a lot easier each time?
Yes.
Great. That's what we want to do. Okay, so now I've got my sponges full of icy cold water. Unfortunately, this is probably the most discomforting part. However, I think it's the best part because it's like putting the flame out. We're going to begin here at the décolleté, come across, and douse. I'm not gracefully pulling this across. I'm actually using firmness because I want to drag anything away that's been resurfaced that does not need to be there. I've got this skin that I'm prepping for the Microderm machine to come clean up what I didn't get with my product. How's that feeling so far?
Awesome.
Very good. Making sure you come up behind that ear. We went ahead, remember I said, and crossed the mastoid muscle? We want to clean everything in detail. How's that feeling so far? Still feels tingling down this area?
No, it's pretty good now.
Beautiful. As you're applying this product, always remember you will see skin turn hot pink. I've seen purple. I've seen light pink. Every shade of pink and purple you can imagine. That's normal, and that's what tells you the product is truly working. The product we work with is not buffered. It is straight alpha hydroxy, and I believe it's the best on the market. We use Ideology. It's one of, I think, the better on the market out of all your alpha hydroxys. Not only just the better, but also very reasonable in price so that you can afford to give your client the best service ever at a reduced rate. When they're buying packages here, what we do, we sell 5 and they get the 6th one free. How are you feeling?
Great.
Itching anywhere?
No, little burn. No
Any
itching.
tingling?
No more.
You want to make sure you rinse and rinse and rinse till there is nothing at all that she can feel. It's amazing how they can actually feel more later on if you didn't get it off. And if you didn't get it off properly, when they go to wipe it off, everything will come with it, sometimes to the second layer. So let's make sure we clean her very well before we begin anything else. A lot of people tend to get a lot of sunburn even on their earlobes. We've actually treated earlobes from the outside here and down and around, make them look nice and pretty again. How are you feeling?
Yeah.
So application takes minutes. The process takes up to 7 minutes depending on which one you're using and whether you're layering or not. Always take pictures before and after, especially with each visit, so your client can also see the difference in the visibility, and that helps build your book. And please always advertise it online so that everyone sees what good work you're doing, so you make much more better. I'm going to come back where the scabs are and gently clean them nicely. Because it's a baby scab, it may tend to want to stay into the preference of it. Okay. Welcome back. We're going into our part 2 of our treatment. We're going to begin with a microdermabrasion. So we're going to make sure that we take tissues. I like to use gauze to gently pat the skin. Make sure it's nice and dry. Then I'm going to use the Microderm machine, and I'm going to begin in the areas that are the worst areas because they're the ones we want to disappear the most. Thank you, and welcome back to part 2 of our Microderm and Peel class. We're going to begin on the décolleté area, and we're going to begin in the bad areas first. I'm going to separate. I'm going to turn my machine on. I'm going to start where she had her scars. I'm going to cross, and then I go back the opposite direction. We want to make sure we cover this in every angle. You okay with that? Any discomfort? You may see striping as you're working with your machine. This is perfectly normal. It's sucking the skin up to the surface of the applicator, and at the same time sandblasting off anything that is in its way. coming back, doing it the opposite direction. Taunting with your fingers in between. You always want to work with a tight surface. If you're working with the surface not tight, you won't get in any nook or cranny that you need to be in. That's another reason why we start in the area that's bad, by opening it, separating, and even zigzag back and forth. This application for the microderm will take approximately 22 minutes to 27 minutes. Take your time, do not rush. It is very important that you take your time and that you crisscross like a weave. We want to make sure that we contour and cover each and every inch. I'm going to then turn her head to the left. And I'm going to work on this area here, the neck, and if you'll notice, I'm taking her shoulder and pulling up. You do not have to overwork the neck area. The neck area is pretty tough skin, but if you overwork the area and you do too many passes, you can also leave stripes that could last 3 to 4 days. So when I'm working in my area of the neck and I've cut it up as high as I do on this caliber, then I want to make sure that I'm not going to leave her with any ugly marks left behind that could take 2 to 3 days to leave. Now, if I'm working on someone who I'm doing a lot of extensive work to, I may take it to that degree, but that would be very exceptional. As you're working, you may see the skin have some crystals left behind. This is perfectly normal. You're going to brush those off at the very end. As I'm working, you can actually see the skin sucking up to the machine itself. You want to be very gentle in doing that. You don't want to rub hard on the skin. You want the skin to actually come up to the machine, and you're just gliding it across. I'm going to come to the ear area here, and I'm going to go down and around the mastoid muscle. I'm going to peel the ear backwards and also clean very well behind there with the machine. It really makes a difference. A lot of women will get a lot of the microderms and get their skin peeled and in shape before they ever get a facelift done. It's utmost importance for you to have it done that way so that you may have better results from your facelift. In the eye area, I'm going to turn my machine down just a notch. I'm working generally right in the areas where she has a lot of the crow's feet that she doesn't need. She's earned those mainly from smiling. Up close to her upper lip so that I may get across the chin area very well. Once I'm finished going in that direction, I'm going to crisscross again, just like I'm weaving. And as you can see, if you look very close, you'll see lots of skin right here. The skin is actually peeling off and coming right to the machine. When I see that, I'll come back and gently go over it, not too abrasive, because the mask that I end up putting on her will remove the extra. If your client is to feel any discomfort, they are to automatically tell you, because it's very important. This doesn't mean this is supposed to be a painful situation. This is to nothing but go in, clean out, and make beautiful and pure new skin. We're removing the top layers to get to the gorgeous layers that she's been looking for. I'm going to come across here. Basically at the forehead, coming directly towards me. You may use the stroke in many directions. If you're using short strokes, leave it longer before you pull away so that it gets the proper suction and the proper amount of standing crystals. When using your Microderm machine, you want to make sure you're using no other machine for the day, nor do you want any type of waxing, especially after having a peel. I'm working now on her main area here that was very deep. It was actually double what it is today, and it's really coming out nicely. I'm going to pull her eyelids up and very gently go across those as well. It is one of the most exercised parts of your body. However, we still want to give it a good treatment. The more you moisturize and the more you take care around the eyes, the better the eyes always come out. I'm taking now her cheek. I'm going to pull it down in a V area. I'm going to come in a V area as well and come across the swoop where the actual lines are. Now I'm going to pull open completely in two different directions and go directly in it. And I'm complete there. I'm going to come back to the top. I'm going to do my weave in my opposite direction. What the client goes home with and what they cleanse their skin with is very, very important. Moisturize, moisturize, moisturize. I don't care if they even have oily skin. Moisturize, moisturize, moisturize. That's the most important thing I can tell you. Once you're over moisturized, what could be the worst possible thing that can happen? It's going to loosen any dead skin that doesn't belong there. Job well done at that point. Coming back to my V, I'm also going to pull here between the nose and the forehead, and I'm going to dot with that in the inside in the middle, and then finish going straight across. You never have to worry about the crystals going in the client's eyes the whole time the machine's working. One of the components is shooting out the crystals, and the other component in the same part of the handpiece is absorbing and sucking away. Remember, when working in a shorter area, do longer strokes, just a little longer. Since they're short strokes, stay a little longer so you get the adequate amount of crystals that you need. Always focusing on the bad area first, then finishing on top in two directions. I'm now going to go to the eyelid, pull up. I'm going to go directly into the eyebrow and across. Coming down and around the crow's feet here. It's amazing how minimal they become in after the fourth series. I'd say you actually see the main difference like you've never seen. When you come for your first visit, the first visit is extreme because it is so overwhelming. But when you get to the fourth one, it's just a big hurrah from there. Coming back, going the opposite direction. If you have any vascular services that need to be done on this client, it is best to do vascular first, let it heal and absorb back into the system, and then you may microderm all you want. Otherwise, all you'll be doing is dragging blood right back into any type of broken veins in the face that are not necessary. After removing and cutting off the blood flow, you don't want to have it remain there and stay longer. So it's very important to know what series you're working with and what steps you're taking in order to complete everything you need to get to that younger skin and being beautiful. Coming back, my weave's going to come the other direction. Peel back the ear, come back around the back part of the ear. Coming back to my line area here by the ears. Remember, that's what tells her age in case she was to come up missing. If I see an ear in an elderly person that looks withered or weather-beaten or any type of sun that they did not need, I will also take and run my machine there by taking the lobe pulling forward with my 2 fingers in between and taking care of that area as well. There's no extra charge for that, it just takes seconds. If you have a very fair complected person, I always recommend putting Vaseline around the crest of the nose and also around the lips. I also microderm lips depending on the type of lips they have. And depending on the type of skin they have, I may microderm first and then peel. It depends on the skin I'm actually working on. It really depends. If I'm working with ruddy skin, I'm going to microderm first. The reason why I'm going to microderm first is because it helps alleviate some of the layers that have been laying there so long that make it look ruddy to begin with. I'm going to come back to her scar. I'm going to pull forward and stretch. The speed bump look has left. It doesn't even look like it has a speed bump anymore. And I see her doctor was very smart. He chose an area where he knew would hide it pretty well. But still, even when you're wearing a nice pretty dress, you want to wear a choker, you don't want that showing. So this will alleviate that for you. You okay?
Mm-hmm.
Right now I'm working on the little things that don't belong there, little amelias that like to hang behind the little round spots. And once I open these and break the skin on them, once I give her a little peel, just to add to her cleanser, it will take it right away. 2 to 3 days maximum. Feel good? Any area you feel that I missed?
No.
Okay, wonderful.
Thank you.
We are now going to apply the mask. It is a jelly mask. It's full of oxygen, collagen. This should soothe anything that was in the way of anything we've done so far. We're going to massage in. This is a massaged in mask that remains. They can even wear it home if they'd like. I highly suggest that they do because the difference is phenomenal. If they're leaving to go somewhere, of course, you're not going to be able to do that. Once this procedure's been done, they cannot wear makeup for at least 48 hours. I like to wear gloves when I'm doing the procedure, but I like to wear no gloves when I'm at the ends. I like to get the feel of the skin. It talks to me and tells me everything that I've done and what I've been successful at doing so far. I'm going to come across the mastoid muscle here. Come up behind the ear, give it lots of moisture. Jelly masks are very nice. They absorb into the skin, and I think they do a much better outcome. And as I apply it, I want her skin to absorb everything I'm applying. This is time you give a nice massage that they just love and die for. Come across the eyelids. Scissoring. Just get that in there real good where we've got those nice lines that we want to get rid of. I tell most of my clients that complain, oh, I think I need fillers, I think I need this. Let's get the skin in order first and then truly see what we need. You may not need a filler. After you're done 10th to the, anywhere from the 6th to the 10th visit, if you still have the deep lines, I will send you to a specialist that graduated from artistic here, and she does nothing but fillers for Dr. Choi here in town, who is wonderful. I'm going to leave this on 20 to 30 minutes. I may even let her leave with it. It's up to her, depending on what she's doing for the evening. I like to schedule these appointments for the evening so that they can go home and relax afterwards. Going to come under the eye area here. Come up to the top and hang wide. Okay, now I will turn out the lights. I'll give her some nice sounding music and let her absorb this wonderful mask. Anywhere that I may see that is raw, I'll add extra mask to. The jelly mask seems to do the best, I think, with those. Spreads very nicely. It kind of acts like a little bit of a Band-Aid. We have an area here where we removed a larger mole last week. We want to give it lots of nourishment. And that should complete our segments. Well, welcome back to Artistic School in our facial department. We are working on Cami again. She's here for her 6th visit. We're taking her to the highest level today. On her 6th visit today, we'll be doing 3 different things. We'll be doing a acid peel, we'll be doing the microderm, and some microneedling. So we're going to take her skin to a whole different level to remove anything that's a blemish or any type of open pores and seal them all down. If you'll turn that machine on, we're going to begin with the microderm. I'm going to start in the V area, which is deep. I'm going to concentrate today, since it's our 6th visit, on actually working on the areas that were the worst to begin with. I'll then turn my machine off, do my peel, and begin another microderm after. That is going to be taking this to a whole different level. We're working in the nose area and the widow's peak. Anything that had lines before, we're going to concentrate on those tremendously by spreading them open. Taking her to a whole different level. We're going to extend to the neck where we've had our surgery. You can see it's about 6 inches long. When we started out, it looked more like a speed bump inverted. We're going to be a little bit aggressive today on this so we can get much better results. As you work, you want to take it to the whole different level, almost to drawing blood, because that way you know the surface is down to exactly where you need. You just need to pay attention to the difference in the circumference of the skin. Now we'll turn this microderm machine off. And we're going to proceed to our glycolic. I'm starting her out with the 35% 1.0, and I will be layering. Okay, now we're going to apply our second layer of glycolic. We're using a 35 and a 50% combined together, and no, that does not make 85%. This is not a buffered product. This product works in conjunction with each other, but you're not going to end up with a 85%. It's going to go up no more than 6 decimals max. You'll see that I'm very, very, very fluent on adding as much as I possibly can. I want to make her look glossy. That means the product is absorbing in properly. You just don't ever want to make it to where it can run in any direction. This product goes on like a gel and emulsifies and really resurfaces everything in great detail. Everything okay? Feel any burning? Little tingling?
Just a little.
Be careful coming around the bridge of the nose. No, you don't want to come down and around the actual area there. That can make them feel like they're decapitated unless lines are very deep. That's the only time I make an exception. Okay, we're going to let that sit 3 minutes. Okay, now we're going to begin with removing our glycolic acid. We're doing it with ice cold sponges that have been soaked in ice water. We're going to remove this until she feels no more itching. You got to depend on your client to really communicate well with you so that you can achieve everything you've set out for. I'm going to remove the eye pads so that I can make sure I get in here and clean very well around the eyes. I want to rinse. How's your skin feeling? Itchy?
Yes.
Normal feeling? Any area that was previously scabbed will bleed just a little, but it will shut down and become very easily to manipulate and put back in perspective. The pH, once you use your blocks at the end, all come back to norm. Still itching? How about the nose area, the mouth, chin?
There's just a light burn through the face.
Okay, we don't want to burn, we just want to feel
Yes.
nice and cool.
Very light burn.
Okay. You want to make sure you go in every corner and every crevice that you have to make sure that you've removed it. As you feel the skin, you'll feel an actual temperature, like a slight fever in the skin. This is perfectly normal. If I didn't feel a fever, I'd say something was wrong and the product wasn't working. Now I'm going to use my post balm after this procedure to make the skin feel more healed and ravishing. The skin will feel much better in that position with the post balm because we're going to bring the pH and everything back into perspective. Want to make sure you clean really good behind the ear and the mastoid muscle area. Clean it around the neck area very deeply. Everything feeling okay now? Okay, great. We're going to begin with the microderm. A lot of people ask me why peel first, why microderm first? Well, it really depends on the type of skin. Once you determine what procedure you need to do, you will go differently with every person from one visit to the next. We're going to now start with the microderm. We're going to take it to the highest level. If you'll turn that on for me. We're going to separate the V again. We're going to begin. I'm going to be radically, really disturbing the skin today, drawing blood and scabbing the area, as you can see now. This will heal in about 7 to 10 days completely, leaving her skin ravishing. Like I said, each microderm should take approximately 22 minutes. Going across the mastoid muscle area. Usually 3 strokes is very good and very adequate as far as removal. You'll see me slim back and forth. I'm taking larger areas and taking a little bit longer than norm. Her skin's in really great shape and it's ready for this. Now I'm going to cross-check. I'm not going to touch the area that is raw. Again, back by the mastoid muscle. Coming again to the middle, cross-checking. Spreading our lines, getting right in the middle there, being very aggressive. If you do not spread the skin, you will not achieve the best results due to the fact that the skin needs to be stretched to get every avenue of the whole area. Your client will tell you this feels very irritating during the service. However, when it's done, the outcome will be phenomenal. They won't even care. If you have broken vessels, which a lot of people do, that can be from childhood injury, it could be from drug usage, it could be from popping pimples, a lot of different factors. It can be from car accidents. This will all be corrected at the very end. We could not do microderm without success unless we remove all of the other things after we're done with our microderm. If I went in behind after doing vascular and correcting imperfections, it would draw blood back into that area that would not be needed. You want to come close and tight up into the eye area. And I have the reading on about a medium. Come down around the nose and around the cusp of the nose. Taking my time because the hole has to actually take hold of the skin. If you'll pull your lip down, please. If someone has a lot of crepiness in their actual lip, you may also microderm on low setting. However, Kiwi doesn't have that problem. You'll see here where we've really drawn a lot out. I'm going to come back and do again. And you'll see that the skin is being sucked up to the surface of the machine. And has basically removed all the dead skin in the center of that today. With layering with the peels, this is where we get our results. I'm going to key up with my top here and pull down very gently. Making sure across the bridge of my nose is very well taken care of, because at an angle it's very difficult to do. As you go across the skin, if you see blood come, this is perfectly normal. After the layers and layers of glycolic we've used, it's necessary to go over more than once in those bad areas. If you see something lift, be consistent and make sure you remove it all. And that concludes our Microderm and Peel series of 6. Welcome back to Artistic with Vascular 101. We're going to proceed today by removing spider veins, skin tags, and many other blemishes that don't belong, especially we're going to remove around her eye. Today with cholesterol removal around the eyelids. We're going to tap the petal. We're going to lightly touch. This doesn't go any further than topical. And as you can see, Gamey is jumping because she will feel the two frequencies mixed together that are going to actually boil this out. In my head, I'm counting 1 1,000, 2 1,000, 3 1,000, lift. 1 1,000, 2 1,000, 3 1,000, lift. You'll notice here it's dissolving. In the eye area, it's very tender, and when you first hit the skin, they will jump several times. You may hear like a Rice Krispie sound, snack, crackle, and pop. That means it's actually boiling out what is in the center. You'll see it's turning brown in the center. That's what I'm concentrating on. You always start from the middle and work your way out. I am working on my highest frequency at 0.90. This will absorb back into her system and heal in about a 2-week period. Where you see the skin turning white, that is actually called frothing. This is perfectly normal. That means my machine's doing exactly what it's supposed to. Then I'm going to move on to her pores that are on her nose that are very large. We're going to shut those down today. We clean them out nicely with a peel of a Glycolic 50% with 1.0 layered. This is perfectly normal how this turns brown. It's almost like a green brown. Once you get to the brown green, you'll know you have killed and achieved what you're there for. And you don't want to work out of the circumference of the actual body itself. Now I'm going to begin the nose area. We're going to begin in the wide pores. I'm going to spread the skin open. I'm going to tap, which is she's going to feel very quickly. Once I get to the center of it, I'm going to hold my needle there without going in any further, and you'll see the skin starting to reciprocate. If they're very large pores, I'll go down straight into it, and then what I call a wheel wobble all the way around and in. We'll go to the next one. Let's close this big one here. Kami has beautiful skin. She doesn't need to walk around with wide pores. I'm going to say this came from early adolescence of popping pimples or cleaning out your pores that you kind of overdid. You'll see them closing as I'm working straight on. I can take acne scars and resurface them and make them look brand new. That you may look like you landed on the moon, but I can remove the moon. And this pore you'll see is pushing out nice icky. This does not belong in the pore. You can actually watch the needle set the pore down smaller as soon as I touch. Again, it's frothing. This is normal. As I'm working on the pores, if they're remaining halfway open, I give it a break and walk on another one and come right back to it. Giving the skin a little bit of a rest, tricking it into working. Each pore will react differently. So we want to minimize every pore we possibly can. If while you're working with this machine, if you have anything that comes up to the needle, you need to clear the needle so it doesn't have any obstruction and keeps continuing to work. Oh, this one's a little bit on the larger side, so I'll wiggle a little bit right down the middle. Going back to the largest ones when I'm done here. Some of your large ones may have to be treated 2 to 3 times. You don't want to overwork the skin. That would not be good for it. We correct spider veins, skin tags, moles, anything unwanted. Okay, now we're going to proceed. We're going to go over to this side here where I have broken spider veins. I'm going to extend the skin. I'm going to bring my light closer so I can see everything as I'm working. Beginning here. A lot of times as you hit the vein will just automatically disappear like a streak of lightning. That means generally that it's a newer one. If it doesn't go away quickly, it normally means it's been there quite some time. I'm going to check everything in detail here. See a small one here. Take this one away. And that one's zapped and done. Let's turn this way. Check and see what we got going here. We have a small one here. Just as I tap the skin, you'll see I'm not going in the skin. It's all topical. And you'll notice the skin's frothing. We got another one that goes here and up. We're going to start always at the bottom, tapping gently as we go up. Very nice. That area is covered. We're going to go to the right here. We're going to go to her skin tags. Again, I'm counting in my head, 1, 1,000, 2, 1,000, 3, 1,000, 4. There she goes, all melted away. I'm going to move on to my next one. It's a little bit larger than the one we began with, and you'll see all of a sudden it just aspirates right to my needle. Didn't have to do much. This will actually scrape off the top and we will cauterize and complete. If I can have you look a little bit further to the right for me, Carrie. Another one aspirated. Let's work here. Always remember to begin in the middle. Coming back to my first one, making sure we're complete, and we are. As soon as I see that the skin breaks on its own to the needle, I'll just rub it back and forth very gently. Cauterizing and closing. I'm going to go right in the center. And remember, if you get anything on your needle, you want to make sure you remove. Going back to the same area. A lot of people ask, will these come back? Yes, they will come back. These are hereditary. It'll be just probably in a different area. Here you can see little teeny baby ones. If I release the skin, you'll see them sitting up. If I stretch the skin, you'll see them laying down. So while they're in lay down position, while we're pulling open, just lightly tap. These are the small ones, they'll go away 3 days. Won't even know they were there. This can be sensitive for some people. She's holding the positive, I'm using the negative. We have galvanic and high frequency mixed together. That's what makes our current so successful. Again, removing one of the little moles here. It's attaching itself to my needle. That's perfectly normal. That's what we want it to do. It makes it easier for removal. The area that she has raw here from before, we're going to actually cauterize and shut it down. This will help us heal a lot quicker. And that should do it. This concludes our vascular class combination with microderm, peel, and vascular. Thanks for attending.